Hi, good evening. I'm Jenny Backus, the Communications Director at the Department of Health and Human Services, and we're here live at the White House for our very first White House Facebook chat with Senator Whitehouse and my boss, Secretary...
No relation.
Exactly. And my boss, Secretary Kathleen Sebelius from the Department of Health and Human Services. We're having a little bit of technical difficulties getting the feed out right away, but we have a live stream of questions coming here from Facebook. We also have a bunch of questions that Senator Whitehouse has brought us to talk about tonight from Rhode Island. But first, I'd like to turn it over to my boss, Kathleen Sebelius.
Well, it's great to be with all of you, and certainly to join Senator Whitehouse here. Sheldon is one of the great health leaders in the United States Senate. He came to the Senate armed and ready to go with a passion for health reform, and he's in the right place at the right time, having helped the HELP committee fashion a bill. Where we are right now is a very exciting moment in history. 5 committees have been working on health legislation. The 5th and final committee is about to finish their work product, which means that both the House and the Senate are poised to consider bills and get a bill to the president's desk. I don't know about you, Senator, but the remarkable thing to me is how much really in common these bills have. Everybody agrees that we need new rules for the insurance industry. They shouldn't be able to pick and choose any longer who gets coverage and who doesn't. Everybody agrees that costs are too high and keep skyrocketing, so we've got to have some measures which actually lower costs for all Americans. We got to make sure that this doesn't add to the deficit. So the President and Congress has agreed that this bill should be paid for, unlike many of the measures in the prior administration that just added to our debt. And we've got to make sure that those Americans who don't have coverage actually have an affordable marketplace, a place to shop with bigger numbers and bigger pools, and some kind of a competition for private insurers to keep costs down and give consumers choice. Those are parts of each and every bill, and I don't know what you're hearing from Rhode Island, but I'd be interested to know how you think things are going.
I think things are going very well. I'm delighted that we are where we are in Congress. I think we will have a bill out of the Senate shortly, and I hope very much and expect very confidently that the President will be signing a piece of legislation before Thanksgiving. And that's very consistent with what I'm hearing from Rhode Island. People have a lot of questions, and we'll get to some of them, but they're really, really urgent about us getting something done.
Right.
They know and they understand that the status quo is unacceptable, and they don't care whether the insurance companies like it or whose vested interests need to get overborne for the first time, but they really know that it needs reform. One of the people who's contacted me is Margaret from Wakefield, Rhode Island, and she wrote in and asked, with the economic downturn and high unemployment, middle-class Americans are finding it difficult to make ends meet. Will an individual mandate for insurance coverage place an undue burden on the middle class? What safeguards are included in health care reform legislation to assist those in the middle?
Well, I think Margaret asked a very important question. The President has said consistently that he thinks this is a shared responsibility. Employers should do their part, government should do its part, and individuals should do their part. And so the House and the Senate have embraced that notion. What the bills would say is that everybody has a responsibility to purchase health insurance, affordable health insurance, and that's critical. So anyone who would be looking at a policy that is more than 10% of the income would be excluded from that mandate. Hopefully that won't happen. We'll have affordable coverage. Also, there'll be some subsidies, some help for the lowest income workers so that they can actually pool money in order to get health insurance purchased. So there are a variety of ways to do that. But the important thing is lots of young folks who think they're invincible, don't carry insurance, who end up in a car wreck or end up in a situation, come through an emergency room door. Taxpayers are paying those bills right now. That adds to the cost. It adds to everybody's expense. So having everybody
it's estimated that an average health insurance policy has about $1,000 or more of cost in it right now to cover people who don't have insurance.
That's right.
For their costs being spread around.
So this will lower costs for everybody.
I think it's also important for Margaret's question to recognize that the direction that the healthcare system is going right now is completely unsustainable. In Rhode Island, by 2016, if we don't get something done, a regular middle-class family will be paying $26,000 a year in health care. So it's going to get a lot worse. Something has to be done. And I think a lot of the reforms that focus on the delivery system and improving the quality of care, improving the efficiency, improving electronic health records, paying for results instead of for just more and more procedures, will actually in the long run bring costs down significantly. So in the short run, we protect the middle class. In the health bill, it was an 8% of your income limit. And in the long run, we can turn the very dangerous direction of our healthcare spending back down. And I think we can actually reduce costs, but I know that's more aggressive than the presidency's, but I'm pretty confident about that.
Well, speaking of cost, actually, Butch Ryan emailed in from Chicago earlier tonight, and he says national health spending is expected to reach $2.5 trillion in 2009, accounting for 17.6% of the gross domestic product. By 2018, national healthcare expenditures are expected to reach $4.4 trillion, more than double 2007 spending. So it sounds like the cost argument is out there with people. What's the reaction that you're hearing in Congress on that?
I think it's absolutely critical that we turn this around. It's so significant that it really becomes fairly soon, I think, a matter of national security. You cannot spend 17% of your gross domestic product when the next most expensive country in the world spends only 11%, and have us opening up that difference more and more, eating up more and more of our gross domestic product, and not have it ultimately affect the fiscal health of the country. We have to turn it around, and if we don't do it in the humane and thoughtful and sensible ways that this reform points us at, we'll end up with very, very challenging cuts, frankly, that we have to make to programs that people count on. So now's our moment to get this done and to turn it around. And the opportunity is huge. A lot of people have estimated that the savings are between $1 trillion a year and $750 billion a year. And so I think we have a big opportunity here to turn that around. And clearly, if we're that big of an outlier among all other industrialized nations, there's room for improvement.
Well, not only, as you know, Sheldon, do we spend more, but we get less. So Americans aren't healthier for all that money spent. And so part of the reform is clearly, as you said, driving health quality for everybody each and every time, lowering costs, but also getting a more bang for our buck.
And for all of that, 47 million of us
don't have
aren't even
coverage at all.
insured.
You bet.
Well, Patrick Hutchings actually was emailing in about sort of cost and competition, and he says the healthcare option provides good competition to the private sector, a form of accountability. The marketplace cannot provide this level of competition. So they're talking a lot about cost and competition in the insurance markets. How does the lack of competition, or how important is that in the plans that you're seeing going through Congress right now?
I think it's very significant. The HELP plan that we put out has a very strong competitive public option in. It does not rely on subsidies. It just creates an alternative to the insurance companies, the private insurance companies, that can take advantage of not needing big profits, not paying huge CEO salaries, but most importantly, being willing to change the business model and improve the quality of care and lower cost and not fight so much with the doctors about payment and put its money into actual health care and wellness that produces results for the American people. That, I think, is an important experiment for America to pursue, because if we just leave it up to the private insurance industries to provide the innovation, we are diminishing our own competitive options.
Another question that's coming in goes back on the costs. Fred Lewis, and this is an argument that you definitely hear through this thread a little bit, is healthcare can never be fixed if we don't first control costs associated with malpractice lawsuits.
Well, I think over and over again, the actual dollars and premiums, malpractice premiums, are a little less than 1% of the overall healthcare costs. But President Obama thinks it's important that we look at ways to decrease the so-called defensive medicine, the docs who feel they have to order extra tests or look over their shoulder, which is why he asked our department to launch a program for the first time ever, putting some grant money for hospital systems and states to see what works, to experiment with ways to increase patient safety, improve communications between doctors and patients, getting injured patients paid more quickly, and actually reduce the cost of premiums. So we're going to be taking a look around the country. States will have an opportunity to apply, and those grants will be available in the next 60 days.
And as you know, the president, when he was a colleague of mine in the Senate, supported a very interesting piece of legislation to do that. The point that I think we need to bear in mind is that if you have the choice between reducing the incidence of harms, reducing the incidence of accidents, reducing the incidence of injuries, and taking those same people, injuring them, but not letting them recover for their injuries, the far better path is to try to reduce the injuries.
Yep.
And there's a great deal of effort in this bill to try to make healthcare more efficient, more effective, less dangerous ultimately for the people who get caught up in it.
Well, I think we should go back to some Rhode Island questions, but one last one from that Janice McCabe from Westchester, New York, is talking about her problems with insurance companies and the quality of care that she's getting there. She says, do you ever wait with the insurance companies, living in fear just how much or if all care will be denied? And that thread is coming through in a lot of places inside the Facebook comments that are coming in.
You know, I spent 8 years as an insurance commissioner, so my job was really
I spent 1 year as an insurance commissioner.
I know, we shared that. But, you know, and you saw it, I'm sure, coming through your office. A lot of the job is to fight on behalf of consumers who have bought an insurance policy but can't use it. You know, the docs are told they're not going to pay for this procedure, or they're going to deny this care, or the patient has to leave the hospital. So people are right now, even families in Rhode Island who have coverage, have a lot of issues about whether they can use that coverage, whether the coverage is really going to pay for when they get sick and the treatment that they need. So this would change those insurance rules once and for all.
Yeah, and that's important because we've heard from families in Rhode Island who were doing everything right. The mom and the dad both had jobs. They were raising their children in a home that they owned. They were paying their taxes. They were living within their means. And along came an illness. And they thought they were insured. They had insurance. But once that illness hit that family and they found the limits of that policy and they realized that they couldn't keep things together, we've heard from people who not only lost their child, but then lost their home because the insurance didn't cover it. And if you could just, you know, I can't imagine the feeling of having to lose one's home, the home in which one raised the child, tragedy unimaginable that the child should die, and then to add insult to injury and have the insurance not be adequate so that you then have to lose your home on top of it. It just shows how perverse the system can be for so many Americans.
Well, I think we're going to probably have time for maybe 2 more questions. Should we take, and again, we apologize for the streaming delay, but your questions are coming in live and we're all looking at them as they come. Can we take one more from you, Sheldon, from Rhode Island?
Sure. The other question from Rhode Island is Joyce, who is in North Providence, and she wrote in to ask, how will the cuts to Medicare change my coverage or affect my ability to access care?
Well, I think, Joyce, there's some good news. You know, as part of my job, we run the Medicare system, which is so important to 43 million Americans, including my 88-year-old father. So I take this program very seriously. When Congress talks about savings for Medicare, first of all, not a dime of those savings goes to do anything other than shore up the Medicare system, make sure it's there for generations to come. But we're overpaying for things right now in Medicare. We pay private insurers 14% more for so-called Medicare Advantage programs. You'll still be able to get the program. They're just not going to subsidize insurance companies any longer. We overpay for durable medical equipment because we don't have competitive bidding. Right now, seniors run into a wall with drug benefits. They hit the donut hole. So some of the savings from Medicare will help close that gap in the donut hole. And no longer will there be charges for preventive care. Mammograms and colorectal screenings will now not have a copay for Medicare patients because we know that too many people delay screenings. And so I think in the long run, not only will the Medicare Trust Fund be stronger, but you know, there are going to be some additional benefits provided to Medicare beneficiaries.
Yeah, there have been a lot of very unfortunate scare tactics that have been used in this debate. But the bottom line is that this reform will not cut Medicare benefits, will not cut Medicare coverage, and will not cut Medicare access to physicians.
You know, finally, I know, Sheldon, you were a prosecutor and took this very seriously, but the president has asked the Attorney General and me to really go after fraud and abuse. There's a lot of money in Medicare, and unfortunately that attracts a lot of bad guys. We just settled, for instance, 2 weeks ago, the largest settlement against a drug company ever in the history of the United States, $2.3 billion for a drug company that was out illegally marketing a drug, jeopardizing people's lives and really overcharging. So that money has gone back into the Medicare system, and that's some of the effort that we're going to have underway. People stealing from Medicare beyond notice, because we're going to take this very seriously.
And Kathleen, you as a governor with responsibility for Medicaid budgets certainly saw the effects of what this can do and how important it is to budgets to be able to get this right. And I think enforcement's a very important piece of that. So we really applauded what you did with that drug company.
Well, thank you.
Well, I think we're coming to the end, and again, we apologize for not getting the stream out, but it's been a really lively debate here. Lots of good comments, lots of good questions, lots of people have a lot of concerns, and it seems like want to see some changes, a little bit of difference of opinion about who wants what, but it's been great, and we'd like to thank you all for joining us today. Look forward to seeing you next time, and congratulations again, Senator Whitehouse, for being the very first member of Congress to do this.
I'm very happy to have done it. I hope we do many more. Thank you all for listening in.
Thank you.